Is your hiatal hernia actually a paraesophageal type? Imagine feeling chest discomfort or having trouble swallowing and wondering what's really going on inside your body. Sometimes, a simple hernia might be more complicated than it looks. That's where understanding the difference between types of hiatal hernias becomes important. A hiatal hernia happens when part of your stomach pushes up through the opening in your diaphragm called the esophageal hiatus. This opening is where your esophagus passes through to connect with your stomach. There are different types of hiatal hernias, and knowing which one you have can make a big difference in how it's treated. The most common type is called a sliding hiatal hernia. In this case, the stomach and the lower part of your esophagus slide up into your chest area, especially when you lie down or bend over. This type often causes acid reflux or gastroesophageal reflux disease because it messes with the lower esophageal sphincter, the muscle that keeps acid in your stomach. When that muscle doesn't work right, acid can flow back into your esophagus, causing heartburn and discomfort. Then there are the paraesophageal hernias, which are less common but more serious. In this case, part of your stomach pushes up beside your esophagus through the opening in your diaphragm. The lower esophageal sphincter stays in its normal position, which means acid reflux might not be the main issue. Instead, the problem is that part of your stomach can get trapped or even strangulated, cutting off blood flow. That can lead to complications that need quick medical attention. To figure out if your hernia is paraesophageal, doctors usually do imaging tests like endoscopy, barium swallow x-rays, or Cort scans. These show exactly where your stomach and esophagus are positioned inside your chest. If your hernia is a paraesophageal type, it might not cause typical reflux symptoms but could cause chest pain, difficulty swallowing, or feeling full quickly. Most acid reflux symptoms happen with sliding hernias because they interfere with the lower esophageal sphincter. But paraesophageal hernias can also cause reflux if they affect the shape of the esophageal junction or slow down stomach emptying. In summary, if your hernia is sliding, it's usually linked to acid reflux and GERD symptoms. If it's paraesophageal, it might cause other issues like chest pain or trouble swallowing, and it could be more dangerous. If you experience ongoing heartburn, regurgitation, or chest discomfort, it's important to see a healthcare provider. They can do the right tests and recommend treatment options, which could include lifestyle changes, medications, or surgery if needed. Knowing the type of hernia you have helps your doctor decide the best way to keep you comfortable and safe.